Thank you very much indeed. Now I'm Phil. I'm the project leader for this peptide out in Sweden these days. It's a 30 amino acid peptide. We started with the glucagon sequence and progressively substituted amino acids until we had balanced GLP-1 glucagon activity. It's a once a day subcutaneous injection with a Tmax, as you can see there, of about 4 hours or so, a half-life of around about 8 to 11 hours or so. And this is the results of the first of the phase 2A trials. Those of you who were up early this morning would have heard my colleague Victoria Parker presenting the results of the second of the phase 2As, where we started at a lower dose of 50 and we escalated up to a higher dose of 300. This study, as you can see, looked at a starting dose of 100 micrograms once a day for 4 days, escalating to 150 for 4 days, and then 200 for a total of 33 days. As I said yesterday, for the first 12 days, because of the stage of the program, the patients actually were locked up in a German hospital. And I'm sure this precipitated a change in behavior. Most people with type 2 diabetes aren't blessed with the opportunity to have an apple a day as a snack and aren't actually forced to stick to 3 meals per day. So not too surprisingly, when you look at least some of the results, if you look at panel C over here, you can see the time period in hospital, both the placebo and also the active groups lost a reasonable amount of weight. But the major difference, as you can see in panel D, is after both the placebo and the Medi patients were allowed out free rein, free access to Starbucks, Burger King, and so on, they actually failed to lose any more weight, whereas the Medi group continued to lose weight. We come to glucose control now. You can see around about a 32% fall in glucose AUC after a mixed meal test. The mixed meal test consisted of 1 can of Ensure. The patients, as you can see, came into the trial with a very good hemoglobin A1C, consistent with the usual standard of German care, 7.2%. Despite that, we saw a significant difference in hemoglobin A1C, as you can see on panel F, over only 42 days of treatment at the 200 microgram dose. Just briefly to focus on adverse events, finally, because I was asked about it yesterday when I was presenting the liver data. 4 patients in total dropped out of the study, 3 in the Medi arm. One of the patients had long-standing paroxysmal AF, it turns out, prior to coming into the study. One of the patients had an abscess that needed to go for surgery, and the third one had persistent nausea plus vomiting to drop out. So in total, although you can see there, looking down to the end of table 2 now, towards the right-hand side, around about half of the patients had nausea, 32% of them had at least 1 episode of vomiting. The stickability of patients into the trial was really very high, with only 1 person choosing to drop out due to GI adverse events. The other concern that you can see towards the right-hand side with the graph of changes in blood pressure and changes in pulse rate was, does glucagon activation lead to any greater changes in pulse or blood pressure versus GLP-1 alone? You can see this was really a very reassuring story. We saw over the course of the 42 days a non-significant fall in systolic blood pressure for the 382 group and an increase in pulse rate of about 6.7 beats per minute. Now, I'm always asked how this compares to liraglutide, semaglutide, and so on. Most of the published other GLP-1 data is out to 12 weeks or even out to 26 weeks. There, out to 26 weeks, you see an increase in pulse rate of about 3 beats per minute for most GLP-1s. There were 2 published papers on liraglutide, both of which show over a 6-week period an increase in pulse rate, lo and behold, of 6.8 beats per minute. So, in summary, this is the first phase 2A study of a dual glucagon GLP-1 receptor agonist that shows really robust lowering of blood glucose, robust weight loss, and to really help benchmark people 2.1 kilograms difference versus placebo is greater than the 1.8 that you would see for liraglutide 3 milligrams over the same time period, and greater than the 1.4 that you would see for liraglutide 1.8 over the same time period, and an acceptable adverse event profile to move forward. You already heard Vicky Parker present this morning on the later study that came after this, the 50 to 300 micrograms, and this drug is now currently progressed into phase 2B.